Well, good morning and welcome. My name is Kate Carpenter. I'm the Director of Hospital Quality Initiatives at the Iowa Healthcare Collaborative and Director of the Compass HQIC. And on behalf of our organization and team, we want to thank you for carving out 30 minutes for us on a Monday morning. We want to start off by recognizing that you all are tremendously busy right now. And in recognition of that, we have condensed the session to 30 minutes, but our team will be on the line and available for additional questions after that half hour if you'd like to hang on the line. But our goal really for today is to provide you some critical updates on program launch as you're sort of balancing emergency response with normal life. During this 30 minutes, we're going to be really excited to introduce our new Compass team, and that'll include the clinical improvement consultants that would have reached out to you to introduce themselves last week, so you have an idea of who you'll be working with on this 4-year project. And then we want to make sure that you're receiving the new Compass communications. That's the Compass Navigator and Cliff Notes. We want to talk to you a little bit about the iCompass platform and make sure you're all plugged in there. But probably most importantly, we want to review with you the Compass HQIC timeline so that you know kind of where we're at in the project launch and what's due now, but what will be coming as we enter into 2021. And then wrap up by just having some dialogue around the backdrop that COVID has placed against this project, what we're hearing from CMS, and also how IHC and our team is being flexible and would wish to work with you as you kind of try to balance both things in the coming months. We'll finish up with some Q&A, so if you have questions that come up throughout this 30 minutes, you can enter them through the chat. But when we approach the Q&A session, we have set up today's meeting in a meeting format, so you can unmute your line if you'd like to use your phone line to speak with us. Video functionality is turned on, so if you don't want to have your video on, be sure to check that and just click the start video so that you have that functionality disabled. Okay, so we are really excited to introduce our new team for this project. I have myself and Melissa Perry who are doing some of the project coordination, and many of you know Lexi Udacek. She was with us in the HQIC or the HIN program and is the email that you see assisting you with database questions, with password resets, and where a lot of our general network communications originates from. Additionally, we have 4 clinical improvement consultants with the team. You'll recognize Lana Comstock probably by face and name. She's been with IHC for about 4 years and a tremendous resource to us throughout the HIN program. We also have added a few new members, Kathy Collins, Betsy Pfeiffer, and Brenda Johnson. And together they will be supporting Iowa hospitals through this program. And so if you should have received, every hospital should have received an email from one of them last week, introducing themselves and letting you know that they're your key contact to the program and to IHC throughout the course of this next program, and providing you some updates as far as maybe what your organization still needs to do to get started with the program and how you can contact them as you have questions. So they're tremendous resources. We're really excited to have them all on the team, and I would encourage you, if you didn't receive that email, if you would just send us in a chat, that will help us identify if somebody didn't receive that communication. If you're new, and we do have some Iowa hospitals who didn't participate with us in the last HIN program, and so the idea around clinical improvement consultants may be new to you, but these are really the folks who provide technical assistance to all of the hospitals participating in the HQIC. They help with coaching calls, they do site visits eventually when we're able to travel again, but work with you primarily through phone and video conferencing. They'll provide data support to you as we start to report new program measures, but more importantly, as you start to get that performance data out so that you can use it for quality improvement locally. And then one of the best benefits to participation, obviously, is the incredible education and training that we try to roll out to hospitals free for their participation in the program, and they will help provide some provisional education and best practice tools and work with you as you work to implement best practices and quality improvement in your organization. I've included a few slides on each of them just so you can connect the face with the name, since we're not doing as much travel lately. There you see Lana, and on the next slide is Betsy. Certainly we'll be sending out these slides as a follow-up to today. So we wanted you to have this information with you. We won't be reading through their complete bios, but we wanted you to become familiar with each of their faces and backgrounds as they begin to work with you and reach out in the coming weeks. So many of you who have been working with us in prior programs know that we've always sent out traditionally a monthly newsletter. This used to be, oh gosh, I can't even think of the old name now, but now our monthly newsletter is called the Compass Navigator. It does come out on the first of the month or the next business day. And then we do have the Compass Cliff Notes, which is distributed the 15th of the month or the next business day. That includes any updates. Sometimes when CMS rolls out pacing events and educational opportunities at the first of the month, they don't always have the registration links and things available. So this is kind of a mid-month touch point, if you will. So we want to make sure that you're receiving those. If you are not, please do either chat it into us so we can follow up with you individually, or reach out to your clinical improvement consultant and they can help you troubleshoot why you may not be receiving those communications. Typically, it has to do with either an error in the email address that you've entered on the enrollment profile form when you originally registered for the program, or potentially to do with your IT firewall. So we'd be happy to help talk you through and troubleshoot those issues if they still exist. It's critical, though, that you're receiving those communications because we'll be sharing with you upcoming deliverables, news on reporting, and also our education and training events as the program progresses. We wanted to make sure that you're all connected into iCompass. This is, again, for those of you that were with us in the HIN program, this replaces Hinnovation to sort of give you a sense for what this is. Anyone on your team that you would have included in your enrollment profile was registered for Hinnovation, and they should be receiving a weekly kind of digest that helps show all the different posts and engagement activity that took place in the hospital forum that week. And of course, it's linked, so it makes it easy for them to just click on a post if they'd like to learn more about that or engage with the content. And again, if you have any questions about iCompass, please do either chat into us or reach out to your CIC, and we'd be happy to assist. Given that we were convening you all today, and although it doesn't have anything to do directly with the HQIC program, we wanted to take the opportunity to review some MBQIP Flex program updates that have been recently rolled out. We sent out a communication last week to all of the Iowa critical access hospitals that this impacts. And if you have questions, please reach out to us. But the kind of the high points or the things that we really want to relay is that the Federal Office of Rural Health Policy has made the decision to suspend, and really by suspend, they're extending the suspension of eligibility requirements for the Flex program. And so what this means is if due to public health emergency response, you're unable to regularly report your Flex data, you will not be penalized. Having said that, at some point it will become required again. And so we really do encourage you, in partnership with the Iowa Department of Public Health, if you're able to report, to continue to do so, and or if you kind of get behind for a couple months when things calm down and you get a breather, to try and catch that up and reach out to our team if you have any questions. You may you know that Iowa Healthcare Collaborative has been the MBQIP quality improvement contractor in the state for about a year now. It started just last January, And so we typically do send out your quarterly performance reports, which is kind of a compilation of the data that you report for the program. So your ADTC stuff, the stuff that you're reporting in through NHSN, and also through CART. Those reports are actually being sent as we speak, so you should be receiving them today or tomorrow morning. We just wanted to share, there's been a bit of a delay with that data returning back to us, and that has to do, you'll remember, those reports used to come from Telegen, and then Stroudwater used to kind of pass them. Telegen is no longer a part of the National Flex program. There's a new data company supporting HRSA and the Federal Office of Rural Health Policy. Their name is FMT, and so you'll notice a new logo on those reports, and that's really all it has to do with. IHC is kind of currently evaluating the format of those reports, and as they catch up with the data getting to us, we will be sending out a new reporting schedule so that you know when you can anticipate them coming back to you in 2021. And of course, the data coming back to you is all contingent upon if you're able to do the reporting. And so that's very much a fluid situation. If HRSA, and the Federal Office of Rural Health Policy makes changes to these eligibility requirements, we will be sure to communicate with you rapidly and help you prepare back for that transition. Let's see. So now we're going to kind of switch back to HQIC, but we want to give you that MBQIP update because we know there's a lot of critical access hospitals on the line. So you'll remember, just to kind of do a reset, because we know that you all have a lot going on. This project started in mid-September, September 18th. So we have been working to get you all recruited and enrolled for this new CMS program. In October was when we kind of started to get things moving, and we sent out that checklist, got you all registered for iCompass and the Compass Academy, which is the learning management system through which our education and training will be delivered. And it was in November that the first communications launched, where you're receiving the Compass Navigator and the Compass Cliff Notes and some of the first communication out of the network. And that is also when we rolled out the Compass Hospital Readiness Assessment, or that CHRA. And for those of you that have been with us in previous programs, you will have definitely noticed that that was a new thing. This is something that CMS had asked us to do. This program period is kind of a comprehensive assessment of every hospital enrolled into the program. And so I want to thank you to the many hospitals. I think we have about 85% of hospitals have completed that readiness assessment, because we know it was a lift, but it was a one-time lift, and some of that information will get to travel to your work plan as you begin to report. So I want to thank you for that. If you are one of the hospitals who has not had the opportunity to complete the readiness assessment, just know we understand. Your CIC would have mentioned that when they reached out. Please do lean on them. If there's anything that we can do to help support you, it might be that you can only do a couple sections at a time, or that you'd like to fill it out on paper and then fax or scan it back over to us and have us plug it in electronically. However we can assist you, please do let us know. We understand that it's a bit of a lift. So that kind of, if you can move through those pieces, and I should mention too that on the December to-do list, if you will, there was also a hospital survey monkey that was sent out. It's just a couple of questions, but really it's some additional information CMS is requesting. So they want to know a couple things, like the number of FTEs that you have that are dedicated to IP, and if you share some of your IP staff with other facilities. And they're just yes, no questions, or places where you need to plug in a number. So if your CIC has sent you that hospital survey, it's a Survey Monkey link, it would probably take you just 2 minutes or so to do it, and we'd appreciate if you send on that information. that will sort of complete the full enrollment. I think the last thing we're really trying to get Iowa hospitals through in December, if absolutely possible, is conferring your rights to NHSN. If you were a hospital that was participating with us in the HIN, likely this is done, but you'll remember kind of in the spring we had to update our reporting template to include the COVID information, and so many of you needed to reconfer rights. If you don't know if you've done this or not, no problem. Your CIC will let you know if it's an item we still need you to log in and do. That's something that typically your facility administrator through NHSN has to help with. We would just ask when you plug the group ID number in that you don't try to change the template. It's usually at that point that things maybe go wrong. In the follow-up materials from today, we will also include instructions on how to confer rights to NHSN if that's maybe something you haven't done before. And certainly, please do reach out to your clinical improvement consultant if it's something you'd like them to help walk you through. We're happy to do that. So I did include a couple screenshots of the Compass Hospital Readiness Assessment. For those of you that have not had a chance to complete it, I've tucked them in here. And it basically shows when you load the link, which is also included on this slide, there's a link on the main page of the Readiness Assessment that shows how you can where you can download a paper copy. At each of the sections of the Compass Hospital Readiness Assessment, there is a Save button at the bottom right-hand corner of your screen. And so we've built this survey with the functionality that you could complete a page or two, save it, and then come back to it. On the next slide, it'll show you sort of where the Cognito system is able to send you back a link to your partially completed survey. And then you can come back to it if helpful. On the screen that's on the slide now, we wanted to point your attention to the final component of the readiness assessment, which is the CDC's COVID or emergency preparedness assessment. This is a piece CMS had asked for. This looks fairly lengthy, but we just wanted to point out using the teal arrows that a lot of this is optional. Those radio buttons where it wants to know if you've done something, if it's in progress, or if it's not implemented, those are required. But the open text fields and also several components throughout the page where it just gives you some additional guidance and information that might help you answer the question. Those are not fields that you have to fill out. Required fields are marked with an asterisk. So we just wanted to draw your attention to that piece. Next slide is that link at the bottom. So you can send yourself a link to your uncompleted survey and then just come back and finish additional sections later as you're able to, or as you have time, or some of the questions you might have to go to other team members for and you'll need to come back to finish up the assessment. So just wanted to give you an idea of what those screens look like if you haven't had the opportunity to get in there yet. Okay, and regarding hospital contact info, we know from many of you that there has been some turnover even in the past 60 days. And some of you have been trying to update the contacts that were initially listed on the enrollment profile. We just wanted to share with you how that process works. All of the individuals that you listed on the profile have been loaded to our contact workbook and will receive relevant communications. If you do have a personnel change, you don't need to try and go back and refill out that enrollment form. There's no need. You can just simply email a member of our team, either Lexi or your clinical improvement consultant. Let us know kind of what their role is and give us their email address, and we'd be happy to update that contact on your behalf. Similarly, if there's other or additional folks and team members at your hospital whom you'd like to receive communications, but who maybe were not listed on your enrollment profile in one of those roles, we'd be happy to have them added for you. Just send us their information and we'll ensure that they get the communications. Okay, so we got about 10 minutes left, and I want to talk some about what's coming. In January, you'll be receiving the new program measures. I think that you'll be pleased. There's the focus areas, as we've shared in the early months of the program launch, are very similar to that of the HIN, the harm areas, and also cross-cutting priorities like health equity and patient and family engagement. Those things remain important. We have taken input, and we're also very, very focused on reducing hospital burden. So we're pulling data from everywhere that we can, and they'll be just very limited, I want to say 4 self-reported measures that are required. Other things you can opt to report on if they are aligned with your strategic priorities for the year, but will not be required. So you can expect those coming soon. And kind of to coincide with that, we have been working behind the scenes the past few months to build a new data portal that really incorporates a lot of the hospital feedback that some of you on the line have provided to us the past year or two on enhancements that may be helpful to you. So we've tried to make that a little bit more intuitive. We'll be launching the new portal in January, and alongside of that, some pre-recorded modules to help train you on how you can navigate the portal, how you can complete your work plan, how you can select which measures you'd like to report if there's some optional ones you would like to add, and then, of course, how you actually do the reporting. I think those of you who have been with us and are continuing to use the old portal we used in the HIN program, that's fantastic. I think you'll find it'll be an easy transition. In some ways, there'll be some familiarity, but just with some enhancements and some extra tools. And just kind of browsing through the slide to make sure that there's nothing else I wanted to mention there. I would just say one difference in the portal as we begin to roll that out is that we're going to ask every hospital to identify a main administrative user for their hospital and a backup. So you can choose 1 or 2 people who are your main portal users, or the people who typically are the ones that get in there and report the data, who do the work plan, or who pull performance reports out. We're going to be reaching out to you in the next probably week or 2 to ask you who are the names of those folks. And when the portal goes live, we will send an email to them directly so that they can log in and register as an administrative user. And right from that screen, as soon as their account is verified, they'll be able to, on your own at the facility level, add additional users who can either help with reporting, or you want just to have view-only access of the data and or performance reports. That will give you more control at a hospital level of who maybe from your organization has access to the data and help you monitor that on a regular basis. We implemented that due to hospital feedback. Again, just knowing that there's some shared responsibilities, you're wearing 50 different hats, and also that there's some turnover. So sometimes it gets hard for hospitals to remember, oh, this person left, or this person now works for another hospital. I need to make sure IHC has their access removed. It'll allow you some oversight as to who has account access, and then removing their access if it's appropriate at a later time. Finally, we just wanted to talk about the implications COVID has had on program launch, and a little bit about what CMS is telling us as it relates to the HQIC program. First of all, I just have to share that I've been really impressed with Iowa hospitals, the commitment that you've had to continuing to report quality and safety measures from when HIN ended in March up until what we started again officially in September. And They know, though, that you're very, very busy. We are in contact with them weekly, and they know that we have extended some flexibility as it relates to completing that Compass Hospital Readiness Assessment, and that you may be slower to start some of the programmatic reporting as we roll these things out in January and February. They're really wanting to know if there's things that can be done at the federal level, and subsequently we are wanting to know if there are things that you need that would be helpful for us to offer at a network level. We'd love to have insight into those opportunities. If there's specific training or education, if in your mind you're thinking, gosh, if somebody would put together this, that would be really helpful, please do reach out to us. We'd love to know what those things are. And then finally, we're very, very interested. There's been so much going on in Iowa hospitals the past several months, 10 months nearly. And you guys are all really doing some fantastic and innovative things. New problems sort of present themselves weekly, and you guys are working through to find solutions every day. And we'd really love it if you could send us some of those examples. We'd like to pull together a session that's pre-recorded because we know your availability is not necessarily predictable at this point. But if it's something you'd be willing to share with us, we'd love to highlight your team or your facility in a session that we're planning for mid-January. So if you could reach out to your CIC or any member of the IHC team, just simply with what the innovation is. And innovation, it could be a small thing. We'd love to schedule 5 minutes with you, and we'll include that and highlight your facility in our compilation that we're rolling out in January. And we know that hospitals are really excited to hear what other facilities are doing and help spread best practices and steal and spread ideas across the state. So we're excited to be able to do that. I know that I've used up nearly all of my 30 minutes, so I'm going to pause and open it up for questions. I don't see anything coming in through the chat. Feel free to type in any questions that you may have and or unmute your line. Seeing no questions, we will go ahead and excuse everybody for the day. I really want to thank you for everything you're doing for your communities and for patients. Please reach out to us if there's anything we can do to support you. Our team will hang on the line. So if there's a question maybe you'd like to ask, feel free to hang on and either unmute yourself or type that question into the chat, and we'd be happy to support you. We'll hang here for just another 5 minutes or so in case you have questions. Thank you. Have a great day.